To a parent, every child is special. But very few people want to admit that they or any of their loved ones have special needs. Special needs is an umbrella term that is used to describe a wide array of mild to severe medical, behavioral, developmental, learning, and mental health disorders that limit a child's ability. Because every child with special needs is different, figuring out one's strengths and weaknesses can be key to defining what a child's needs truly are.
All children are unique, and it's very important to recognize each individual child's strengths and interests when planning their treatment. We want to customize their therapy to each individual child in order to maximize their benefit from treatment.
Children with physical disabilities often stand out from their peers. Crutches, a wheelchair, the lack of motor control can define a special needs child. Physical, occupational, and recreational therapies, including adapted sports opportunities, can help children progress physically while building self-esteem and independence.
As a parent of a child with an autism spectrum disorder, it's a very scary time when your child is diagnosed. But yet at that time, it's critically important for you to find a provider who's going to work with you and your family and with the child to help integrate them into the community and help them maximize their potential.
For children with emotional and behavioral issues such as attention deficit hyperactivity disorder, obsessive compulsive disorder, and depression, many therapists believe diagnosis in the early stages can be crucial to proper treatment. An equal blend of parent education, specialized teaching, therapeutic treatment, and possible medical management can all play a role in helping these children assimilate socially and realize their individual potential.
The resiliency of the human spirit is never more evident than in the children we work with. Their inner core of strength, when we focus on what they do well and what is going right for them, seems to enable them to surmount insurmountable challenges. So our dedication is that each child individually be given the tools they need to be the very best they can be.
Developmental disabilities such as fine or gross motor skills and speech delays are often noticed in most children before the age of 5. Early intervention through physical, occupational, and speech therapies can prepare most children to enter kindergarten with their peers, with most able to continue in the mainstream of life. In recent years, autism has come into the spotlight, with national statistics indicating 1 in every 155 children diagnosed each year. Yet all children with autism do not have the same needs.
Autism spectrum disorders are now a spectrum. They fall within a range of very high-functioning children, known as Asperger's disorder, and very low-functioning children mixed with mental retardation. They can have social skill deficits, sensory integration issues, communication deficits, and they can fall within anywhere and shades of gray in between.
Despite so much controversy about what causes autism, most therapists agree that a customized approach can be key to its treatment.
As a parent of a special needs child, it's been very important to bring him here in the physical activity department. Each skill that he masters leads him to have more self-confidence and gives him the ability to master future tasks.
Children with learning disabilities such as dyslexia and central auditory processing disorder have difficulty in any learning situation. These children can benefit from individualized strategies to reach their learning potential and avoid problems of low self-esteem. With a growing number of children being diagnosed with anxiety and depression problems, qualified professional help can be critical for them and their families.
Because every child is different and every family is unique, getting treatment in a setting where the child is comfortable is absolutely critical. One of the ways that we help children maximize their potential is by doing this, and then they can fully participate in family, school, and community activities.
For over 80 years, the Achievement Center has been a cornerstone of care for children and families of the greater Erie, Pennsylvania area. Since its founding in 1923, the Achievement Center has been providing therapeutic services to children with special needs from birth to 21 years of age.
Our work is focused on children who have a need for therapy. It could be a child with autism who needs help with developing communication skills, or a toddler with a developmental delay who needs help with developing the skills to walk, or possibly a middle schooler with a physical disability who needs help learning how to become more independent. At the Achievement Center, the dedicated and professional staff are here to help.
The Achievement Center provides child-centered and family-focused interventions in 3 areas: physical rehabilitation for children with physical disabilities such as spina bifida and muscular dystrophy, early childhood services for infants, toddlers, and preschool-age children with any type of developmental delay or disability, and emotional and behavioral health services for children with diagnoses like autism, ADHD, obsessive-compulsive disorder, and depression. 2 specialty areas of the Achievement Center are attention deficit hyperactivity disorder and autism. The center has excelled in treatments and intervention for children with ADHD, including a summer treatment program which has received national and international recognition. It has been recognized and sought after by parents and therapists to model treatments and intervention for children with autism. Their inclusive summer autism program is unique to the community.
At the Achievement Center, we continue to grow our programs and services. For 85 years, we've maximized the potential of children by recognizing trends and being innovative in providing services to those children in our region.